Hey Sherry, it's been a minute, about 90 seconds since I saw you last.
Yeah, Aditya, good to see you.
Good to see you too. How are things?
Things are outstanding. It's a good day to be alive.
It is. The rain has stopped here in Dallas, which means for a moment it's only hot. It's not hot and thunderstormy, so I'm happy for that.
This would be a good time for me to share that we have beautiful 68 degrees here in Los Angeles. It's sunny as usual.
I'm the one who moved away from 65 every day in San Francisco, so this one's fully on me. I accept what I've done to myself. Welcome everybody to episode 10 of Digital Health on Air. My name is Aditya. I'm one of the founders and CTO here at Luma. Today I'm joined by the illustrious Shri Velamoor, President and COO of NextGen Healthcare. Shri, you want to give a quick hello and say hello to the Digital Health on Air audience?
Hello, audience. Really thrilled and excited to be here. I'd say it's a privilege to be joining you, Aditya, and the extended Luma team and all the folks on the webinar here today. So excited to have this conversation.
We're super happy to have Shri join. Luma and NextGen have been working very, very closely to deliver kind of some market-leading solutions into the broader world of patient engagement. I got to know Shri probably coming up on 2.5, maybe 3 years ago now. We met at a conference, and a long-lasting friendship kind of spawned from there.
Yes, our eyes met across the health booth as I was walking by in a large conference hall, and then the magic happened. We saw the partnership immediately. So it's
I
been fun.
like that our booth and our marketing team really super happy to hear that the booth caught your attention, not my beautiful eyes.
Shout
So
out to the marketing ROI team on that one.
exactly. They've done their work. So Shri, you joined NextGen probably about a year, now about 2.5 years ago now, and you've recently moved into a new role of president and COO. So kind of just to kick us off, can you share a little bit about what's this new role about? What are you focusing NextGen on? Kind of what's kind of top of mind for you as you navigate growing the NextGen business and making impact in healthcare?
No, I appreciate that, Aditya. It actually the journey to NextGen started much earlier, right? I've been passionate about this intersection of healthcare and technology for a long time, and really thinking about how do we take all this disruptive tech that's been available to us the last 20, 25 years
Sure.
and find a way to change healthcare care delivery models and business models with it. I worked across a whole bunch of subsectors, trying to really get an ecosystem view. How do all the pieces and parts in this lovely industry of ours work together? Got to do that at McKinsey for 10 years and got to the point where I felt ready to actually jump in and get my hands on the steering wheel at a couple of companies where it felt like it could be a platform to drive the kind of change that I was excited to bring to the industry. Um, had the joy of knowing a couple of folks at NextGen. They asked me to come in and be the chief growth officer originally
Right.
while we were a public company. That journey translated into the current role, which is okay. We hit our growth curve. Things are going well. We're serving customers at scale. We just got taken private about 5, 6 months ago with Toma Bravo. That's been a fun part of the journey, and now we're ready to do that next evolution, which is take all the great ideas and really drive impact at a meaningful level.
I like
You
that.
know
And then
this well. Yeah.
one of the things that is interesting to me, so I have a lot of friends. You spent a career arc in consulting. When you make the shift to industry, as they call it, the vantage changes quite a bit, right? From being like horizontal to suddenly being very much involved in like your platform. So I'm kind of interested, like any things that you've seen differently as an operator in NextGen, kind of running the business versus when you had a kind of a more bird's eye view of the industry.
Probably the biggest difference is that the bird's eye view of the industry affords you the ability to look at the different incentive models and business models and the
Hmm.
puts takes between all the stakeholders in the system as a neutral party. But when you're an operator and you're in a platform, you have the stake in the game, you have
Yeah,
skin in the game.
sure.
So I think the awareness of how all the different pieces and parts work and come together and who's motivated by what is extremely helpful from this vantage point where I'm sitting down here, and it allows partnerships like ours to come together
Sure.
because
Yep.
you could see the win-wins and you could also see situations where folks are not quite necessarily going to partner with you because their incentives aren't aligned with yours or stacked against yours.
I
Uh,
think that really ties in interestingly to, like changing priorities, because there's a I think a big part of the next gen customer base, I should say, is like FQHCs and kind of people who are, the incentives are very like different between, say, like commercial health systems, like non-for-profit, and then, very much like safety net systems. And those incentive models have changed over the last, really actually, COVID money's kind of basically disappeared.
Yeah.
So curious, like to like get your thoughts on that as like, priority shifts change, but also like the incentives have probably moved along the way.
Yeah, incentives are shifting all the time in our sector, and I like to say that calcified incentive models are going to beat down innovative business models all day, every day. And for those of us who are still wondering why do we use fax machines in healthcare, there's your answer, right? And same reason why telehealth. It took something like COVID and legislative action for that to pick up, and we're still dealing with reimbursement and price transparency and a whole bunch of other things. So there's always tons of change in our sector. As you noted, Aditya, the interesting part is, how do you keep an eye on all these things that are going on, but stay true to yourself as an organization and what your identity needs to be all about? And this is where I think the values of your organization help you align what's happening externally and, adjust to the incentive structure in a way that kind of keeps your organization going in the right direction.
Yeah. So let's talk about values for a second, because I mean, you're, senior leader in your organization. What are those values? What are those big pieces that, help align an entire organization to that one vision?
Yeah, our mission statement, actually, funnily enough, we came together as a leadership team about a year and a half or so ago and said, we inherited the mission statement from prior. And you want it to be enduring, but at the same time, you want it to be something that the current leadership team can own and get behind. And we came up with something very simple. Funnily enough, it was our engineering leader that did it at the time and said, we can build software, we can build feature functionality, but at the end of the day, we're all here because we love the mission aspect of what we do. And better healthcare outcomes for all was the mission statement that we wrapped around. And it was simple, but it got to the point, right? Whether it's the tripartite claim or the quadruple aim, however it is people define it, rallying around the fact that we want to improve access, we want to improve quality, we want to improve convenience, we want to improve experience. It's easy for everyone to get behind. And then from a values perspective, we said, well, what are the things that, how do we live our values so the mission becomes real?
Yeah.
Three things that we pick were: one, think like a client, think like a customer.
Yep.
Number two, own the outcome. And number three, care personally. And we have other values as well, but these are the three that everyone...
Those sounds like those are the ones that you internalize.
Those are the ones you internalize, because then every day you wake up and you put yourself in the shoes of your customer and say, how do we get up and make their lives better today? How do we help them serve their communities better today so everyone gets to a better outcome? And that's a fantastic North Star for everyone to work around as the world.
I think like one of the things about being a supplier for EHR technology and EHR software is, outside of like electricity and Microsoft Windows, like there is literally probably nothing else that a clinic touches more than your software. And like with that comes like such an incredible sense of responsibility. And, that sense of responsibility, like as there's a yin and a yang there, like innovation, right? It's like, I want to change stuff. I want to make it better. I see what's happening, but like, I'm using your software every single day. Don't mess it up. Like, how do you, service to your customers is critical. Like you have to make them happy, but balancing against like, what your ambition and your vision and your mission are becomes challenging too. So how do you kind of help guide your teams into kind of the yin and the yang between those two elements?
That's a fantastic question, and something we wrestle with every day, right? We are a mission critical platform and workflow tool for, over 10,000 practices, 100,000 providers that touch almost 120 million patients every day.
Yeah, inspiring responsibility, honestly. 1 in 3 Americans, right? Basically.
It's wonderful, but it keeps you grounded about why you're doing what you're doing. And with it comes this back and forth of, how do you innovate and create agility and continue to bring good things to that massive community of folks, but at the same time do it responsibly? Like we can't just have the luxury of chasing shiny objects at a pace that everybody else can. And one of the phrases I like to use is, we could either be a gatekeeper or we could be a gateway. And I think far too often EHRs have kind of had this mindset of being a gatekeeper. We're trying to evolve towards saying, we are the gateway, we are the essential platform. So how do we make sure that our communities get what they need on this platform? And I'll do a shout out to your organization, Luma here. It was that spirit that led us to working with you, because we want to bring the best of what a patient experience could be as a gateway for our clients to access this capability. And it's the same attitude we're taking towards a whole bunch of newer things that come along.
Yeah, and one of the new things that you guys have been working on and deploy, and I had a chance to see it at your client summit last year, was ambient capabilities, which is AI powered. It's you and I we are on the same conference circuit. We go to the same places, and you can't go more than a foot inside of a conference hall without seeing something about AI. But so it's maybe a little tired conversation at this point, but at the same point, an incredibly important one because that balancing act between the shiny things and like in the service of your customers, AI kind of really stands out as maybe something that can bridge both sides.
Yeah.
So, I think the clinical, like the ambient capabilities that you guys have talked about is sort of in that category that bridges both. So I'm curious to get like a little bit of your take on like, how AI kind of can infuse itself onto both sides of that equation.
Yeah, AI is interesting, right? I think it means a lot. It means a lot of things to a lot of different people. A lot of times, really, people are just talking about good old-fashioned machine learning or automation.
Yeah, like stuff that like has had machine learning in the wild for now like 10 years, right? It's like
indeed the truly kind of generative AI that's doing entirely new things or augmenting or replacing tasking in jobs in our sector. That's where the real excitement can be. But taking a step back, when we look at AI, we absolutely recognize the disruptive potential of the technology here. But balancing that responsible way of bringing it to our customer base, we're being very deliberate in how we deploy it. Yeah. And the answer is we always start with, hey, where is there unnecessary friction in the physician journey or the patient journey? What problem are we really trying to solve? And is AI really the best way to solve that problem? Versus let's just go throw that in there because it's the cool thing to do.
There's a funny webcomic I saw a couple of weeks ago, which was basically like, it's like, some nerdy tech product manager type of thing. And it was basically like the product as a piece of toast and like butter as AI just spread all over. Like, and that's what
it certainly feels that way.
Yeah, it does. It does. It's like, could you just peanut butter it or spread it everywhere? Sure. But like, is there actual endearing, lasting, like generational value in doing that? Probably not.
Yeah. So I think, and you could do it in phases. I think the obvious use cases, you've mentioned ambient and clinical documentation, decision support capabilities, any place where it can enable, accelerate, or augment are obvious places where as a co-pilot or augmented intelligence, if you will, that paradigm makes a ton of sense to use it immediately. Any places where it starts to essentially replace tasks or is creating entirely new job families, we need to understand the implications of where you're transferring the thinking to this.
Right, and where the actual activity in the clinic is going, which is, when you think a little bit more about the operation, the function of the clinic, there's often, at least at Luma, we kind of think about like, there's top line, which is like, how do we help more patients arrive and book and schedule and reduce no-shows? And there's bottom line, which is like, how do you remove like, friction from the system? And, there's work that we do on both sides of that coin. Obviously, there's work that you guys do on both sides of the coin. But as you think as like an EHR evolves over the course of, say, the next 10 years, as you continue to, evolve the product, where do you hear from clients like that comes from? And, obviously we'll pepper in a little bit of AI on that because I think it might apply on both ends, but curious to see what you hear, what you're feeling, kind of where you're directing the teams on that top line versus bottom line, acquisition versus friction.
Yeah, it's, I'd probably say it's a healthy balance of both of those. We don't necessarily hear A versus the other. I'd actually take it back a little further and say, if you're the practice of the future and you're leading one of these for the next 3 to 5 years, what are top of mind concerns for you? The things we hear most frequently are, number one, staff shortages.
Yep.
Nearly 88% of practices are impacted by not having enough administrators and workers to help with them. We hear about payment declines, right? 22% reduction in reimbursements over the last 2 decades if you use CMS benchmarks.
Yeah, on like a fixed dollar basis. Yeah.
Exactly. Denials are increasing, right? It's 8% year over year. Nearly 11% of all claims are denied currently. And then the cost of medical services, because inflation is almost up, anywhere from 2.2 to 5.4% over the last couple of years.
Yeah, you've got compression on both ends, right?
You got compression on both ends. So the only way you dig yourself out of this mess is more self-service tools, retaining the patients that are coming through your door and delivering quality services so you get paid for them effectively. So I don't think you have the luxury of saying is acquisition of new patients more important versus sort of the cost of getting them through the throughput aspects of having them pass through the clinics. You have to do both.
Right.
You have a choice in that.
So, okay, that's great. Perfect. You kind of have to do both. I would imagine, look, I think as I look at our product and reflect on kind of what you're saying, we are helping on both ends. We want to kind of the core ethos to Luma is making it easier for patients to see their physician. But what excites you on this? Like, what if you look forward? Like, we can talk a little about doom and gloom and like AI is going to do this, but like, what's exciting right now? Like, where are the things that you're plotting the future for, actively designing that clinic of the future?
Yep. So the three things that I'm really excited about. Number one, pajama time. is what the doctors call it, right? So they're looking for that 1.5 to 2 hours of their day at the end of the workday where they're using it to do documenting or
Charting or all the other stuff.
entry or chart capture, billing, and all of that. I think eliminating the need for that extra 1.5 to 2 hours and giving that time back to them. Some physicians are going to use that to go spend time with their families. Some are going to use it to see more patients, particularly.
Sure, but that's their that becomes their choice.
That becomes their choice, but giving them that choice and allowing them to grow their practice or manage lifestyle, that's a fantastic option. Number two is every clinician is fatigued with the amount of alerts and notification that they
Yes.
They want intelligence at the point of care, but they want it to be consumable. And I think all the work we've done around interoperability and technology has thrown more things at your care providers to deal with, not less. So now I think when you layer AI on top of it, it can do that initial triaging and present
Yes.
the right
And it's
data.
incredibly useful, like going back to what we were saying a couple minutes ago, that bird's eye view, like, but for the physician as they go in, what are my next best actions? What are the chart alerts as a confidential patient? Like all these pieces synthesized, so I'm not clicking on 7 tabs to get each one of those. Big part of like
super helpful. And then the third area where I think it's incredibly exciting is it's helping reduce information asymmetry. So because this thing has the ability to now let clinicians, patients, other care providers, extenders, essentially all see the same view of the data because it's no longer costly and onerous to stitch all this information together in a consumable summary. You're potentially reducing errors. You're allowing greater extensibility of care across the board. So,
one of the
things.
Well, great little anecdote that I heard from one of our customers, chief access officer, was one of the main reasons. If you zoom back, one of the main reasons a patient calls my clinic is so that someone on the other side of the screen can look at a screen that they can't see.
Exactly.
Right. I'm like, what a horrible but interesting way of saying that, right? Which is like that information asymmetry between the clinic and the practice and the patient. Like that's an area where we can, within room of safety, like we can actually do quite a bit there to eliminate that. I mean, so the anecdote that's really stood out for me, and it really nicely tucks into your third bullet there.
Yeah. And another area we're talking about related to that, right, is what are my benefits? How much am I eligible for? What am I totally. And allowing people to actually get value out of what they're paying for health insurance, which is another huge area. I'm sure we would all enjoy that.
Yeah, and you talk a lot when we talk one-on-one about the closed loop experience that you're aiming to deliver to patients, and this is part of it. So I think for like the viewers here of Digital Health on Air, it'd be super valuable to get your words. What is a closed loop experience? Because it puts the patient really at the center of of their own journey.
No, I think the last word you just used, Aditya, is at the core of what that means. So when we talk about a closed loop patient experience, what we're really talking about is going from a linear version of patient journeys to more of a multimodal, multi-channel experience where patient journeys can non-linearly evolve and they can be self-directed at the end of the day. So as patients, 80% of their healthcare services are actually consumed outside of an inpatient facility.
Yep.
But they just, they might want to make an appointment while they're at the Starbucks. They might want to hear their lab results while they're sitting in the parking lot waiting for their kid's baseball game. So I think our notion of how patients want to consume health services and how they want to engage with the health system has fundamentally evolved in the last couple of years. And having tools like yours and us orchestrating and stitching together different aspects of the patient journey so they can self-direct how they want to connect the dots and how they want to traverse from point A to point B. That is at the core of what we mean when we talk about the closed loop patient experience. It's like we're putting all the tools together to allow them the ability to go shape the journeys as they see fit instead of us prescribing it for them.
Yeah, I mean, you hear this a lot when you're talking to CIOs and healthcare technology leaders, which is we want to have an airplane like United Airlines, American Airlines like experience. And I like that a lot because those are built around the exception cases. I don't like it a lot because there's only 3 airlines in America, right? So like, the incentives and the cost structure to deploy that is very, very different. But that kind of that's thought that I think what you're getting at is the technology should really not be what the patient sees. It should fade in the background. The patient's experience is actually what's actually driving the car around that closed loop, if you will.
Yep. I want to go from step 1 to step 19, and I don't want you to become the limiter for how I go from A to B. I think us working together to enable that through the platforms that we're creating, I think that's the magic.
Yeah, I completely agree. And then, the hard part about that is, assembling all this stuff, interoperating all this stuff, and making it so the patient sees no seams between, a Luma doing this, a NextGen doing that, a clearinghouse doing this. That's, I think, what becomes really, really hard. And I think it's the thing that you said your former technology leader had said in the past, which is the thought that, the patient, we're here to, make better outcomes. Writing the software is actually kind of the easy part. Actually putting the outcome together becomes the hard part.
No, absolutely. And the trick in doing this is, historically, at least in our sector, we've always built these as point solutions where
Right.
it's also been the supplier out view. I'm going to solve problem A and here's how I solve it. I think the magic here is to start with the outcomes. If you were to go with that and you say, hey, what is the experience I want to deliver and the way I want the journey to progress, you would design these and you would integrate these very differently. And then I think there's an important point you made is who feels accountable for actually doing this, orchestrating this convening and this stitching. And there aren't that many platforms out there in the industry who have the right to actually connect the dots across all these discrete point solutions and these technologies on behalf of the consumer.
Yeah, I'd like to believe that we're collectively one of them. Yeah, exactly. And it begs me to maybe come to maybe a final thought here, which is like you've shared with us a whole bunch of thoughts on like how the industry's moving, how the technology can fade in the background, but there has to be some orchestrator there that stitches together the stuff, not taking the supplier's view. But your advice, like on what advice would you give to technology leaders to really start to like think, whether they're health system CIOs, your customer base, what advice would you give them to really be able to cut through the noise and make a big difference to their patients, their constituents, whomever those might be?
I'd say, to eat the same dog food we're eating, which is, lead with outcomes at the end of the day. Because here's the reality of it, nearly 22 to 30 billion dollars of invested capital is going into digital technology and digital health every year. Thousands of companies are cropping up each year. So the incentive model is designed for more fragmentation, more point solutions to emerge at this point in time, at least economically. I think the onus on all participants that are starting that journey, regardless of whether you're an incumbent or you're a new party, is start with the outcome that you have in mind.
I love that.
And I think evaluate at that point in time whether co-opetition or integration or partnerships allow you to get to that outcome more effectively than just trying to go solve your small piece of the world and leaving everything else behind.
I mean, I think it's the same way that you'd actually, it's almost a physician's recipe, right? Start with the outcome, right? You want to figure out what the outcome we want to get to is. And, whether it's Tylenol or Advil that gets you there, the details are sort of less important than the direction where you want to end the journey.
Yeah. And honestly, many of these other companies likely are not going to get the scale that they're looking for if they don't take that plan anyway. So I agree with on both dimensions.
I'll take that every day. Sri, episode 10, our 10th anniversary of Digital Health on Air. Incredible advice from you on, how to make impactful change inside of healthcare and how to lead healthcare organizations towards, that clinic of the future. Thank you so much for your time today. I think what you shared with the audience is invaluable, and we'd love to have you back on at some point in the future. But, really appreciate the partnership and appreciate all the fun we've had today. And thank you for spending a little bit of your day with us here today.
Pleasure to be here. Thanks for having me.
Cheers.
Bye.
Enjoy the weather in LA.
Thank you.